All right. Hello, my name is Ruben Meinhofer. I'm here to do your physical assessment today. Is it okay if I do your assessment?
Yes.
Can you tell me your name?
My name is Jennifer Distor,
Can you tell me your height?
5'2".
Can you tell me your weight?
110 pounds.
Okay, first we're going to start off by checking your radial pulse. I'm going to take your radial pulse for 30 seconds and multiply it by 2. Okay, I got a pulse rate of 64. Okay, the next thing I'm going to do is check your blood pressure. At the same time, I'm going to check your breathing, and I'm going to, for 30 seconds, and I'm going to multiply that by 2 as well. Okay, I'm going to turn on the machine, make sure it's nice and snug. The Velcro's nice and snug. You can rest your arm. Here we go. And we're going to start. I'll check your respirations. Okay, your respirations are 18. Your respiratory effort is unlabored, and looks like you're taking deep respirations. Your blood pressure is 134/91. Are you having any pain?
No.
Thank you. Let me take this cuff off your arm. All right, first I'm going to start also by checking your skin. I'm going to start off by checking your hands and your nails. So your hands feel warm. I don't see any moisture. I don't see any swelling. I don't detect any ridges, clubbing, any yellowness, any thickness to your fingernails. And I'm going to check your capillary refill. First on your left hand. It's less than 2 seconds. Less than 2 seconds. Thank you. And now we're going to check your skin for any lesions. I don't see any lesions. Your skin looks consistent with ethnic background. Also, your skin feels warm. It is dry. The texture is smooth. I don't see any tenting. No tenting. Next, I'm going to check your scalp, hair, and cranium. So it appears to me that it's normocephalic. Do you feel any tenderness when I'm touching your head?
No.
Okay. Alrighty. I don't see no scaling, no lumps, no lesions. Also, have you ever had any traumatic event to your head, any head injuries before?
No.
I don't see no evidence of head trauma. Also, I'm going to check also your face for symmetry. Your face looks symmetrical. I'm going to check cranial nerve number 7. All right, I'm going to ask you to raise your eyebrows and look up. Okay, good. All right, I'm going to ask you to puff your cheeks. Keep them puffed. Okay, good strength. And can you smile and open your, actually, I want you to show me your teeth. Smile and open your teeth. Good, thank you. All righty, so facial cranial nerve number 7 appears to be intact. Now we're going to move on to your eyes. So I'm going to look at the external structures. I see even hair distribution. I also see that your eyebrows are symmetric and your eyes are symmetric. So I don't see any ptosis, any lid lag, any discharge. I don't see any crusting. So the sclera looks white and I don't see any jaundice. Okay, no lesions or redness. And next I'm going to check your pupils. So I am going to check your pupils at rest. and constricted. So I'm going to shine a bright light in your eyes. So I see, I'm going to start by shedding a light to your left eye. Just look straight ahead. Okay, the eyes are 4 at rest, and when constricted, they're 3 millimeters. Both eyes are equal and round. And I'm going to check you for accommodation. If you could look at the top of my pen light and just follow it. The eyes are accommodating. So we have Perla. Pupils are equal, round, and reactive to light, and accommodating. Okie dokie. So now I'm also going to check your visual fields, cranial nerve number 7, and confrontation. So I am going to start by asking you to cover your right eye while I cover my other eye. Okay, and then I'm going to ask you to see when you see my finger coming into your visual field.
No.
Okay, how about now?
No. No. No.
Okay, now can you cover your other eye? Okay, and I'm going to start again. Tell me when my finger comes into your visual field.
No. 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 No.
All right, thank you. You can look forward. I'm going to ask you to, I'm going to check for extraocular eye movements. If you can just follow, keep your head straight, looking forward. You can follow my pen light and just follow my pen light with your eyes. Good. Okay. So now I'm going to check for corneal light reflex. I'm going to shine a light in your eye and see if the light is shining on both spots in the pupils. So yes, I see that the pupils are symmetric and present in the corneal light reflex. So we have the light shining on the same spot in the pupil, which is midline. Also, I do not see any nystagmus and any strabismus. So also I'm going to see if you can tell me, we're going to check your visual fields as well. So if you could close your, cover your eyes again, one eye at a time. Okay, I'm going to cover my eye. And then I want you to tell me how many fingers am I holding up?
2. 1. 2. 1.
Okay, and cover your other eye and look straight ahead of my eye. Look at my eye. Okay, how many fingers do you see?
2. 1. 1. 2.
Thank you. Okay, dokie. So we don't have any problems in there. So we have extraocular eye movements are intact. Okay. We have no abnormalities. We have consensual light reflex is positive. Okay. Next, we're going to check your ears. If you could turn your head to the right, I'm going to check your ears. Okie dokie. I don't see no discharge. I don't see any redness, any lesions. Okay, I'm going to touch. Do you feel any tenderness when I press down on your ear?
No.
Okay, no drainage noted. And can you do the same? I'm going to check your right ear. If you could turn this way. I see no drainage. Do you feel any tenderness when I push down?
No.
So I see the ear is intact and no lesions present. All right, do you have any ringing in your ears?
No.
Do you feel dizzy when you stand? Any vertigo?
No.
Okie dokie. Do you have any earaches?
No.
Any tenderness?
No.
Okay, dokie. Do you wear any hearing aids?
No.
Okay, so no hearing aids. None. Alrighty, now I'm going to check your nose for symmetry. Your nose appears symmetrical. I'm going to check the patency of your nostrils. So I'm going to press your left one and I want you to inhale slowly. Good. And then the next one. So there appears to be no discharge. Do you have any nosebleeds?
No.
Okay. Next, I'm going to check your mouth and throat, especially your lips and buccal mucosa at the moment. So your lips appear to be pink and dry. And I'm going to ask you to open your mouth and I'm going to take a look in your oral mucosa. Alrighty, so. All right, if you can look in, can you stick your tongue out? Okay, I'm going to check for gag reflex. Okay, gag is present. Alrighty, thank you. Can you open up again? And oral mucosa, buccal mucosa looks pink and moist. Thank you. And the uvula, let me check again one more time. I'm going to check your uvula. The uvula, can you stick your tongue out? Thank you. It is midline and intact. Gag reflex is present. So we're going to check those off. Moist pink, uvula, gag reflex, midline, gums are pink. And how many times a day do you brush your teeth?
Twice a day.
And do you floss daily?
Yes.
When was the last dental visit?
May 16.
And I see your teeth are not discolored, and none of it see any presence of caries. Okay, we're going to move on. So now we're going to check your neck. We're going to check your carotid pulse. Okay. Carotid pulse is present on the left. Carotid pulse is present on the right. I'm going to listen for a bruit. No bruit present. The trachea appears to be midline. Okie dokie, now we're going to check range of muscle of your neck. So if you could turn your head actually to the right, and turn it to the left, and to the middle again. Can you put your chin to your chest, and can you look straight up? Good. So now we're going to do this with resistance. If you could turn your head to the left against my hand, and to the right. Excellent. And can you push forward with your head? Okay. And can you push back? Good. All right, so we have full range of motion and full range of motion against resistance. And I want to ask you if you can shrug your shoulders against my hands. Good. I got good shoulder shrug against resistance. Next, we're going to move on to the posterior chest and lungs. If you could turn around for me, please. Can you spin around and show me your back? Okay, I'm going to pull you back a little bit toward me. Thank you. So now, first thing I'm going to do is check for symmetric expansion of your chest. I want you to take a deep breath. Good. And relax. And take a deep breath. Thank you. One more time. Okay, good. We got symmetric expansion. I don't see no barrel chest. I don't see no accessory muscle use. I don't see no pectus excavatum, which is usually the front. Secondly, I'm going to check for tactile fremitus. I want you to say 99 after me.
99, 99, 99, 99, 99, 99.
Thank you. So I got normal tactile fremitus on the right and the left. Do you feel any tenderness when I push down?
No.
Okay, I don't feel any lumps. Okie dokie. So now I'm going to check for costovertebral tenderness. So tell me if you feel any tenderness. I'm going to go below the 12th rib.
No. No.
Okay, thank you. Now it's non-tender on both sides, on the left and the right. And next we're going to listen to your posterior breath sounds. I'm going to go through the right upper lobe. Okay, take a deep breath. Thank you. You can breathe out. Breathe in. Breathe out. You can breathe in. Breathe out. Let me check your left. Okay, breathe in. Breathe out. Breathe in. Breathe out. Breathe in. And breathe out. So I hear vesicular breath sounds on all lung fields. No adventitious sounds, no rhonchi, no crackles, no wheezes, and they're not diminished. Okie dokie. So we're going to move on to the next part. GoPro, start recording. Now we're going to check the anterior chest and lungs. If you could spin around for me. Okay, we're going to check for tactile fremitus like we did before, and let me know if it feels tender. Say,
No.
if you could repeat 99 after me.
99, 99, 99, 99, 99, 99.
Thank you. Okay, Dookie. I didn't feel any lumps. Did you feel any tenderness when I was pushing down on
No,
and listening for factor fremitus? No tenderness?
no.
Okay, Dookie. I'm going to listen to your anterior breath sounds. So once again, I'm going to take a listen and just breathe in and breathe out. Okay. Thank you. Okay, the next thing I want to do is check your, and I want to report actually that your anterior breath sounds all are clear. Vesicular breath sounds in the right upper lobe, left upper lobe, left lower lobe, right lower lobe, and left lower lobe are all clear. Vesicular breath sounds are present. I don't hear any rhonchi, crackles, wheezes, or any debridus breath sounds on all your lung fields. Next, I'm going to listen. Actually, I'm going to feel for your apical impulse. So I'm going to just feel here, see if I can feel it. And I'm also going to, okay, so it is palpable. All right, I'm going to check your apical heart rate for 60 seconds. Okay, dokie, I'm going to take a quick listen for 1 minute. Okay. Okay, thank you. I got an apical heart rate of 66. Okay, I'm going to listen to your heart sounds. I'm going to listen to the aortic and pulmonic at first, the second intercostal rib. S2, S1 present, S1, S2. Let's listen now to the pulmonic. And listen to the Erb's point, the third intercostal space. The tricuspid. S1, S2 present as well. The mitral. I can hear S1, S2. No murmurs, rubs, or gallops heard on any of the 5 points. Okie dokie, let's see. Now we're going to move on to the upper extremities range of motion. Okay, if you can stretch your arms out like this, thank you. And can you move your hands up and down? Can you move them up like this? Spread your fingers. Good. And can you push down against my hands? Okay. And can you pull up against my hands? Good. And now can you pull your arms towards you against resistance? Pull them. Good. Thank you. All right. So we have full range of motion on the left and the right, and they're equal bilaterally and strong. So full range of motion, equal bilaterally, strong. And next I want to check your brachial pulse and your radial pulse on both sides, the left and the right. So I'm going to feel for your brachial pulse. Brachial pulse is a 2+ on the right. I'm going to feel your radial pulse. It's a 2+ on the right as well. Check the brachial pulse on the left arm, 2+. Radial pulse on the right. Correction on the left arm, it's a 2+. Okie dokie. So I'm going to put 2+. Next, I'm going to ask you to lay on the couch there, and I'm going to check you for the presence of jugular venous distension. Okay. I'm looking at the left side of your neck, and I don't see no venous jugular distension. I'm checking on the right, and I don't see no venous jugular distension. Okay, I'm going to come around and get my chair. I'm going to check your abdomen. Okay, the next thing I want to do is check your abdomen. The contour looks flat, symmetric. I don't see any bulging, any masses. The umbilicus is inverted. I don't see no pulsations occurring in the abdomen on inspection. No bulging, no pulsations, no mass. Now I'm going to check your bowel sounds in all 4 quadrants. Let me see if I can get a better view here. Let me move this around. So I'm going to check your right upper quadrant. Right lower quadrant. Bowel sounds are present as well, normal active. Left upper quadrant. Bowel sounds are present, normal active. Left lower quadrant. Bowel sounds are present, normal active. Now I'm going to start doing some light percussion and let me know if there is any tenderness as well. So I'm going to check for tympani.
No.
Any tenderness?
No.
Any tenderness when I push down?
No.
No tenderness on all 4 quadrants. All 4 quadrants are tympanic. Next, I'm going to do some deep palpation. And do you feel any tenderness?
No.
It feels soft. Right upper quadrant is soft. Left upper quadrant is soft. Left lower quadrant is soft. Right lower quadrant is soft. No masses are felt and no tenderness reported by the patient. Next, we're going to move on to, if I can get this page flipped, to the lower extremities. We're going to check for symmetry, skin characteristics, and hair distribution. So apparently, currently the hair, there's no hair on their legs. The lower extremities look symmetrical. There's no cyanosis, no ulcers, no pallor, no erythema, no varicosities, no lesions observed. Okay, so now I'm going to check your toes for any clubbing. I don't see any clubbing in her toes. I am going to check the cap refill of her toes. I'm going to squeeze here, less than 2 seconds. Less than 2 seconds. Okay, we're doing good there. And now I'm going to check for pretibial edema. No pretibial edema. Your skin is warm on the left and the right and dry. Okay, dokie. The next thing I want to do is I want to check your pulses of your lower extremities. So I'm going to check the femoral pulses. Left femoral pulse is a 2 plus. Right femoral pulse is a 2 plus. Going to check your popliteal pulse. Two plus. The right popliteal pulse is a 2 plus. Then I'm going to check your posterior tibial. I feel a 2 plus in your posterior tibial on the left, posterior tibial on the right, 2 plus. Going to check your dorsalis pedis on the right, 2 plus. Dorsalis pedis on the left, 2 plus. Okay. Moving on to the next section, we're going to check your hip range of motion. So I'm going to ask you to raise your right leg straight up. There you go, 90 degrees. And can you bend it? Good. 120. You can relax. And can you do the same thing with the left leg? There we go. All the way up. If you can bend your leg, perfect. You can lay it back down. And we're going to check for internal rotation. Again, can you bend your knee here? And can you move it inward? There you go. And outward again. Good job. And can you straighten out your leg? All right. Can you do the same thing with the left leg? Okay, rotate it outwardly and inwardly. Okie dokie. And that's it. You can lay your leg straight out. Did you, let me see if, I'm also going to check your hips to see if there's any pain or tenderness or crepitation. So they're going to check for stability. Okay, I'm squeezing. Do you feel any pain?
No.
Okay. No crepitus, no instability, no tenderness, no pain. Okie dokie. So let me check these off. Okay, so, and now we're going to move on to the ankles and feet. We're going to check range of motion and strength. Okay, so first, I'm going to just palpate your feet. All right, did you feel any pain or tenderness when I check your feet?
No.
Okay. I don't see no ulcers, no redness, no edema, no tenderness, and she mentioned no pain. So I'm going to ask you if you can pull up against my hands. There you go. And can you push down like a gas pedal? Thank you. So dorsiflexion, plantar flexion are on the right are present. And I'm going to check for your version. Can you move separate your feet to the sides? Like, there you go. And back to the inside. Good. So we got eversion on the left and the right. Dorsiflexion, plantar flexion are present and strong. Okay. Next, we're going to move on to the next section. We're going to check the bilateral deep tendon reflexes. Okay, for this, I'm going to ask you to return to a sitting position. We're going to come back to this chair. If you could have a seat there, please. First, we're going to start with the biceps. Okay, if I can borrow your bicep there. If you could just relax your arm. If you could just let it hang, actually. Okay, I'm going to check. Okay, good. And I'm going to check also your, here we go, we're going to check your tricep tendon. Okay, if you could just relax your arm. Good. Okay, next I'm going to check your radial brachial. All right, so you can just relax. There we go, thank you. Same thing with this arm. We're going to check your brachial. Let me try again. Good. And your tricep. Okay, and your brachioradius. Good. Thank you very much. Now we're going to check your patellar and your Achilles. So we are going to check your patellar. So if you could just kind of hang your leg like this, I'll support it. I'm going to check your patellar reflex. You can relax your leg. Here we go. There we go. Good job. And now we're going to check your Achilles. So I'm going to hold your foot there. All right. Good. You can relax your right leg. And I'm going to check your patellar on the left. You can relax your leg. I can hold it. Here we go. Okay. One more time. There we go. Let's do your Achilles. All right. I'm going to support your foot here. It should point down. There we go. One more time. Pointing down. Thank you. All right. So we have done the deep tendon reflexes for the biceps, triceps, brachioradialis, patellar, and Achilles. They were all 2+. And now we're going to do the sensation. We're going to check your face, arms, hands, legs, and feet. Can you close your eyes and tell me if it's sharp or dull?
Sharp. Done. Sharp. Sharp. Done. Done. Sharp. Sharp. Done. Sharp.
Thank you. So that's the first sensation for the arms, hands, and feet, and legs. Apparently everything was appropriate. She was able to detect sharpness and softness or dullness with no issues. Now we're going to check your spine. If you could please just stand and face in this direction. I'm going to ask you to touch your toes. Okay, and I'm going to check your spine while you do that. I see it's symmetrical. I don't feel any step stops, any bumps. Do you feel any tenderness?
No.
Okay, you can stand up straight, please. Thank you very much. I'm going to check this off. You got full range of motion. Okay, I'm going to ask you to do range of motion of the spine. Can you twist to your left and twist to your right? Any pain or tenderness?
No.
Okay, I want you to lean forward a little bit. Any pain or tenderness? Okay, good. Can you lean back? Good, thank you. You got full range of motion of the spine. I would like to ask you to do a shallow knee bend. If you could just bend slightly. Thank you very much. Full range of motion. Any pain with that?
No.
Okay, no pain. Okay, if you could just stand right there and walk heel to toe to right around here. Good, heel to toe. And if you could turn around and walk back on your tippy toes, the tips of your toes, and okay, those are your heels. Good. Okay, good job. All right, you can turn around and walk on your tippy toes. There you go. Perfect. And you can come back, please. You can walk normally. Alrighty, so I just want to advise you to follow up with your primary care provider as needed. And I want to thank you for your time with this assessment. Also, thank you for taking the time to assess my performance for C349 of the health assessment. My name again is Ruben Meinhofer, and thank you for your time.